Good morning, and thank you all for being here. My name is Claudia Lennhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers. On Tuesday of this week, Representative Rodney Davis held office hours at his local district office on Fox Drive in Champaign. About 250 people showed up to talk to Representative Davis, and the vast majority of them were there to talk to him because they were upset about his recent vote in support of the House Republicans' health care bill, the American Health Care Act. The American Health Care Act would repeal significant provisions of the Affordable Care Act, known as the ACA or Obamacare, and would drastically cut funding for Medicaid. Representative Davis's comments to his constituents and his public statements to the media and on his website and Facebook page have been extremely misleading or incorrect and seem to indicate that Representative Davis does not understand key aspects of the bill he just voted for, and also does not have a working knowledge of the Affordable Care Act and how it is in fact working very well for most Americans and for his constituents. We are concerned about Representative Davis's misinformation and his seeming lack of knowledge about health policy in the bill he just voted for. We are here today to correct the misinformation that Representative Davis has stated about the Affordable Care Act, Medicaid, and the House Republican bill, the American Health Care Act. I want to introduce you to our speakers today, and then I will give a brief statement about the Affordable Care Act. Today we are joined by three consumers to my left who have benefited from the Affordable Care Act. They are James Bean, Deniece Stevens, and Kevin McGuire. We are also joined on my right by Julie Pryde, who is the Champaign-Urbana Public Health District Administrator and who will speak to the preventive health and public health aspects of the Affordable Care Act and how the American Health Care Act undermines those. Then, actually, after our consumers speak, we're going to switch out, and healthcare consumer staff members will join us. Chris Garcia will provide an overview of the American Health Care Act. Tayabji will talk about the cuts to Medicaid in that bill, and Adani Sanchez will talk about how the bill undermines protections for people with pre-existing conditions. And then I will close by briefly discussing the massive tax cuts to the wealthy that are part of this bill. So now, to get us started with I will make some brief comments about the Affordable Care Act, also known as the ACA. Representative Davis stated that, quote, "We have 60 million people in this country that don't have insurance, even though the laws require them to, or they can't afford to use the coverage they have. That is not a success," unquote. In his efforts to damn the Affordable Care Act, Representative Davis routinely conflates the numbers of uninsured people with the numbers of insured people who are covered but are worried about being able to afford their care. We do not have 60 million uninsured people in this country. Representative Davis also never acknowledges the rate of uninsured before the Affordable Care Act and the massive and historic gains in health insurance coverage as a result of the Affordable Care Act. Representative Davis never speaks directly about the impact of the Affordable Care Act on our own local community, but he routinely speaks of the broken promises under the ACA and the millions of Americans who still remain uninsured. Here is what Representative Davis needs to know. Thanks to the Affordable Care Act, our nation's uninsured rate is at the lowest it has ever been. Before the Affordable Care Act, 16% of Americans lacked health insurance coverage. The uninsured rate was reaching 50 million. Now that rate has been cut in half to about 8.6% in 2016. Over 20 million people who previously did not have coverage are now covered. And here in Champaign County, the uninsured rate dropped from 16% in 2013 to 5% in 2016, as more than 11,000 people in Champaign County gained health insurance under the Affordable Care Act. Representative Davis is right that too many in our country remain uninsured. Right now, about 27.3 million people remain uninsured nationally, but it's not because the Affordable Care Act has failed them. The vast majority of those who remain uninsured are uninsured because they are low-income people who live in states that have refused to expand their Medicaid programs under the ACA. That is not a failure of the Affordable Care Act, as Representative Davis claims, but a failure of those state governments that have failed to provide health security for their residents. Something that Representative Rodney Davis, with his vote for the American Health Care Act, wants to encourage even further. So now I want to turn it over to Jim Bean, followed by Deniece Stevens and Kevin McGuire, so you can hear directly from local consumers about how the ACA has worked for them.
Good morning. My name is James Bean, and I'm a resident of Urbana, Illinois. 6,891 residents in Champaign County have gained health insurance coverage through the Medicaid expansion made possible by the Affordable Care Act. I'm happy to say that I'm one of those residents. Thanks to the ACA and the Medicaid expansion in Illinois, I was able to get health insurance coverage for the first time in my adult life in 2014 when I was 54 years old. Before that, the last time I had health insurance was when I was in the United States Navy. I was discharged from the Navy in October of 1979. I've worked my entire adult life. Besides being a musician, that doesn't pay very well. I've worked a lot of different jobs, including construction and working as a painter. None of those jobs ever provided benefits. I worked at the University of Illinois for over 30 years, 20 years as a stagehand and 10 years as a union rigger and spotlight operator. So again, I was in a union for 10 of those years, and even then I didn't have health care coverage from the university. They kept me classified as part-time extra help, 30 years of part-time extra help. The other thing is that job ruined my back, the rigging job, and as a result, I can no longer work and am now waiting for Social Security disability. For decades, literally decades, I suffered with untreated health problems, including lots of pain from dental problems. So as soon as it was possible for me to apply for health insurance under the Affordable Care Act, I did with the help of the Champaign County Healthcare Consumers. I qualified for the expanded Medicaid, and all of a sudden, I could start taking care of things that had been a problem for me for such a long time. I got set up with a primary care doctor, and now my doctor's visits and my prescriptions are covered by Medicaid. I get pain medication for my back. I'm in chronic pain because of the damage done during rigging. I have also been able to get hearing aids, and for the first time in years, I've been able to hear the wind blow through the trees. I was also able to get lots of dental care and extractions, and for the first time in decades, I have not had chronic pain from dental problems. And now I'm getting ready to have a hernia surgery. I don't have to worry about the medical bills and whether I can afford to get that care. And that's the important thing that I wanted to say about health insurance, and in my case, about Medicaid. Not only does it help cover the costs of the care you need, but just as importantly, it gives you peace of mind and security. You know that if there is a problem, you can go see a doctor and get help. I'm very grateful for the Affordable Care Act and for the expanded Medicaid program.
Thank you, Jim. Next we'll hear from Deniece.
Good morning, I'm Deniece Stevens, and I do benefit also from the Affordable Care Act. At one point, they were going to take the medical card that I have once my children turned 18, my last one. And then I came into dealing with some health issues and chronic pain as well. So having it is, like Mr. Bean said, some security. And I hope they don't change a thing, because if they do, then my pre-existing conditions that I already have now, I'm not sure what would happen with them. And I'm just struggling, trying to live, and I don't have money for medical bills or even my prescriptions at times. So I hope everything just stays the same. And now my children also benefit from having the Affordable Care Act. They all work very hard. My son works 2 jobs, but he still can't afford health insurance. So I'm still happy that and thankful that it's there, and hopefully it'll continue to be there for us. So good luck with it.
Mm-hmm.
Thank you.
Thank you, Deniece.
Hi there, I'm Kevin McGuire, also from Urbana, graduate of the University of Illinois in bassoon performance. Not a lot of professional bassoon gigs out there, so I've done other things, basically teaching and whatnot in California. Returned to the area in '94. My first day working at the University of Illinois was working farm aid in 1985, and you know, as a freshman in college, well, this is kind of cool. So when I came back to the area in '94, since '94, I've been a professional stagehand and working with the union, working at Assembly Hall. I've worked everybody from Adani to Manilow to you name it. But the problem with the University of Illinois is that it's an extra help position. We're only allowed to work 900 hours, and then we have to take 30 days off so that we don't get insurance. So you're constantly in this state of flux, like, you know, it's feast or famine. We work very hard, as Jim was saying. I mean, sometimes we're working 60, 70 hours a week when they decide to have Garth Brooks and Tom Petty and Ebert Fest and all this, like, right on top of each other. It's very difficult. So in order to try to get insurance in the past, I got a job teaching at Cunningham Children's Home, and so it was nice to have insurance there for a little while. But then again, too, it kind of took me away from doing what I love working with the kids as well, but I also love what I do on stage and with performers. And so when I left the Cunningham job, also did my insurance. And it wasn't until the Affordable Care Act and friendship with Claudia and Adani that I've been able to get things set up and kind of get onto a road to better health. I was hit by a semi-truck in '95, and it pretty much almost took my life. He was going about 85 miles an hour, and I lost a lot of weight at the time, and then I gained it all back. And so I'm trying to lose, and I'm working with doctors right now. And again, like you were saying, if they take it away, I'm afraid that the progress that I'm starting to make, working with my primary care physician and everybody else at Carl, that could go away. That frightens me. My son just turned 18. I want to watch him grow and see him flourish in his future as well. And so I don't know, again, with the changes that are proposed, the uncertainty of the future, it's not an extra thing that is welcome by any means. So
Thank you, Kevin.
thank you for your time.
And one thing about Kevin that I wanted to note is Kevin actually now gets his health insurance under the Affordable Care Act, but through the marketplace.
Through the marketplace, correct.
And the marketplace and the tax credits have adjusted as your situation has changed. And Deniece, who gets her health insurance through the expanded Medicaid, as Jim does, was previously covered by the regular Medicaid program, as were her children. But as she was saying, when her last daughter aged out at age 18, they would have been uninsured were it not for being able to get covered by the expanded Medicaid. So thank you all so much for your statements. And we will release you now. You can join the audience, and we'll ask for the healthcare consumer staff members to come up. Yeah, catch and release. And next we will hear from Julie Pryde, who's the administrator for the Champaign-Urbana Public Health District, and she'll be talking from a slightly different perspective about prevention and public health.
Okay, so you've heard a lot about the actual healthcare part of it, but what you don't realize is that the Affordable Care Act has a large part of it to do with basically controlling how and what the hospitals and insurance companies do so that the care is more centered on prevention. Prevention of disease and injury saves money. There is no debating this. This is a fact. There are very specific provisions in the Affordable Care Act that expand access to primary and secondary prevention services such as immunizations and regular disease screenings. Most health plans are now required to provide preventative health care services to plan members without charging a copayment. Preventative health services include blood pressure and cholesterol screenings, cancer screenings such as colonoscopies and mammograms, and immunizations, vaccinations for adults and youth, and not just flu shots, but also shingles vaccines. Those were very expensive. Pneumonia vaccinations, and even vaccines against certain types of cancers. I don't think that it's difficult for people to understand that preventing just one case of cervical cancer or liver cancer with a vaccination is going to save a lot of money. I don't think it should be difficult for people to understand that catching one early colon cancer through a colonoscopy or catching one early cervical cancer through a Pap test is going to save not only horrible heartache and devastation often to a family, but also it's going to save money. Another thing that I think gets left off of this that has really shown, in even the short time that ACA has been around, is the access of services for women's health care. So we're talking about women's health care services, family planning, the birth control options without the barrier of a copayment. Because somebody can say, oh, well, you know, you a $20 copayment for pills, that's not bad. That's not bad unless you don't have it. If you don't have it, you don't have birth control. So, again, I'm really curious when people talk about, you know, wanting to prevent unwanted pregnancies and wanting to prevent abortions, and yet we are putting up barriers to teen pregnancies, unwanted pregnancies. We have already seen the numbers go down, not only in our county, it's happening everywhere. And I love some of the excuses people give why that's happening. I even had one person claim that teen birth rates were going down because of cell phone usage. They're too busy on their phones. No, that actually is not true. It has to do with being able to get birth control with no co-payments. And these are all the birth control options. And it's not just you go pick up your pills. There's health care behind that. And it should also be very, very, very evident to insurers and the hospitals and everyone else involved that when you allow women to have access to prenatal services and prenatal care, that you're less likely to have adverse birth outcomes. And it does not take a genius to do the math to figure out how many women can receive those services for the cost of one premature baby in a neonatal intensive care unit. They call those babies $1 million babies for a reason. So again, the amount of preventative services that you can purchase through the Affordable Care Act with no copay is amazing. Another thing that I don't think anyone understands are the other preventative pieces to this bill. The legislation beginning this is from the Congressional Budget Office. The legislation would beginning in fiscal year 2019, repeal the provision that established the Prevention and Public Health Fund, which no one outside of people in public health even know exists, but it would rescind all unobligated balances, i.e. yank the money back. The Department of Health and Human Services awards grants through the fund to public and private entities to carry out prevention, wellness, and public health activities. Funding under the current law is projected to be $1 billion in 2017 and rise to $2 billion in 2025 and each year thereafter. So the Congressional Budget Office estimates that by just eliminating this piece of the fund, it would reduce spending by $9 billion. Now, again, I just told you how much prevention saves. So if they're saving $9 billion, at what cost? It's exponential. Again, preventing disease and injury saves money. There is no debating this. It is a fact.
Thank you, Julie. Okay, and now for a brief overview of the American Health Care Act, I'll turn it over to Chris Garcia.
Hi, good morning, everyone. So on May 4th, 2017, Representative Rodney Davis joined 216 of his Republican colleagues in the U.S. House of Representatives in voting for the amended American Health Care Act, which would repeal many provisions of the Affordable Care Act and radically restructure and cut funding for Medicaid. The amended AHCA was passed without a Congressional Budget Office score, without public hearings, and it was opposed by every major national medical, health, and consumer organization. The AHCA projections by the Congressional Budget Office would mean that 24 million people would be uninsured by 2026. That breaks down to about 14 million in 2018, 21 million by 2020, and then 24 million by 2026. 14 million of the 24 million who would lose insurance by 2026 currently have Medicaid. It would also raise premiums and deductibles by thousands of dollars for millions more, slash Medicaid by more than $880 billion, provide $860 billion in tax cuts to the extremely wealthy and wealthy corporations. It would also gut protections for millions of people with pre-existing conditions, and it would end national standards for what health insurance plans must cover, and end the nationwide ban on annual and lifetime limits. And then I'm going to turn it over to Jen to speak about the AHCA and the effects that it will have on Medicaid.
Thank you. The American Health Care Act that Representative Davis voted for utterly devastates the Medicaid expansion created by the Affordable Care Act. Even worse, this legislation guts the entire Medicaid program, enacted in 1965 and including the Medicaid expansion, by a massive $880 billion cut, according to the Congressional Budget Office. Currently, Medicaid provides health care to about 74 million low-income, disabled, and elderly Americans. As a result of the American Health Care Act, 14 million fewer people would have access to Medicaid by 2026, according to the CBO analysis of the earlier bill, which contained similar Medicaid provisions to the final version passed on May 4th. The cuts would also hurt special education programs, which receive about $4 billion from Medicaid every year. Under the American Health Care Act, the Medicaid expansion, which currently provides coverage to more than 10 million low-income Americans, would freeze on January 1st, 2020. Adults could no longer qualify for expanded Medicaid, which right now is simply based on income. If they are on Medicaid and lose their coverage in 2020 or after, they would not be able to re-enroll. The American Health Care Act also converts Medicaid into a block grant or per capita grant program, stripping more than $880 billion from the program over 10 years. That's about 1/4 of its budget. Because block granted programs can't keep up with the needs of beneficiaries or rates of inflation, this means that states would have to respond to fiscal restrictions by cutting benefits or throwing enrollees out of the program. This puts states in an impossible position of having to choose what to cover: a newborn's life-saving surgery, substance abuse treatment for community members to help curb the opioid epidemic, or much-needed custodial care for older Illinoisans in nursing homes. This change in how states would receive federal Medicaid funds would fundamentally alter the 52-year-old program. Medicaid has always been an open-ended commitment. If a state had an increase in Medicaid spending, they were reimbursed for a portion of that cost. This flexibility allows states to adapt to economic downturns like the recession or natural disasters like a tornado that result in loss of income. Another change to Medicaid under the American Health Care Act would be allowing for states to seek waivers to require able-bodied adults on Medicaid to work. But this is a futile requirement that adds more burden to states in processing applications without accomplishing anything. As you can see on the pink handout in your packets, currently 59% of adults on Medicaid who are not receiving Supplemental Security Income or SSI do work, and 41% are working full-time. Of the other 41% that are not working, 35% are ill or disabled, 28% are taking care of family members, 18% are in school, 8% are retired, and 8% could not find work. Several states are already seeking work requirement waivers under the new administration. This is not health policy. This is a shameful way to take away the healthcare safety net from millions of Americans. Representative Davis stated this week that the solution for coverage should be employer-sponsored coverage. My question for Representative Davis is, how will that happen when more than half of the adult Medicaid recipients are already working, especially when the American Health Care Act that he voted for takes away the employer mandate? Representative Davis never addresses the cuts to the Medicaid program. Instead, in a press release from March 7th, he claims that the American Health Care Act, in his post, does not pull the rug out from anyone, including Medicaid recipients, allows those who are part of the Medicaid expansion to continue to have coverage unless their economic situation improves, and then lets states create programs that will best help their most vulnerable. Representative Davis, you need to know that in Illinois, Medicaid pays for about 50% of all births and 50% of all long-term and nursing home care. 650,000 Illinois residents are part of the Medicaid expansion. In addition, as indicated on the blue handout in your packet, the Illinois Health and Hospital Association expects that this cut would result in a loss of $40 billion in federal Medicaid funding over 10 years to Illinois alone. And next, Adani is going to talk about the effect of the American Health Care Act on pre-existing conditions.
Thank you. The American Health Care Act, which passed with the McGuire Amendment, would allow states to waive both the requirement that insurers sell policies to people with prior health conditions without charging them higher rates, as well as the requirement that insurance plans cover a set of services called the essential health benefits. Representative Davis claims that the amended American Health Care Act will continue to cover pre-existing conditions and that it actually adds more protections. He also claims that no one can be refused coverage because of their pre-existing conditions. Although the bill still requires that health insurance be guaranteed issue, which means that it is required to cover those with pre-existing conditions, this amendment would allow insurers to charge those with pre-existing conditions pretty much whatever they want to if they have a gap in coverage, effectively pricing out those with pre-existing conditions. By eliminating the essential health benefit requirements, it would allow policies themselves to be utterly meaningless, since they might not cover what people need. Insurers could claim that they don't discriminate while also having policies that don't cover maternity care, mental health services, prescriptions, or labs, for example. This will take us back to where we were before the ACA, when insurers could sell incomplete plans. A guarantee of the ability to purchase such plans is not the same as access to affordable and comprehensive health insurance. And this doesn't just affect those on the individual marketplaces. Those with employer-based coverage would also be affected. Large enough employers could choose which state to base their health insurance out of, and if they chose a state that waived certain essential health benefits, those with pre-existing conditions and employer coverage could be offered plans that do not cover what they need or have essential services capped, since they are no longer protected from annual limits. Under the ACA, employer plans must cover the nationally mandated essential health benefits, and in doing so are prohibited from placing annual and lifetime caps on coverage. They must also have a maximum annual out-of-pocket limit. In its estimate of the effects of an earlier version of the bill, the Congressional Budget Office said that about 7 million fewer Americans would have health insurance through work if the Republican health plan became law, compared with what would happen under current law. Representative Davis needs to know that there is no indication that the American Health Care Act would add more protections for those with pre-existing conditions. In fact, it seems that the American Health Care Act would actually threaten to increase costs and degrade the coverage available to all of those with pre-existing conditions, especially the nearly 300,000 which live here in the 13th Congressional District. And next, I would like to turn it over to Claudia to talk about tax cuts in the American Health Care Act.
Thank you, Donnie. Now, I would like to briefly talk about the American Health Care Act's tax cuts for the wealthy, something that Representative Davis never comments on. According to the Congressional Budget Office, the bill that Representative Davis voted for would repeal the Affordable Care Act's tax provisions, and it would provide America's wealthiest taxpayers with an immediate tax cut totaling $346 billion over 10 years. Every cent of that would go to taxpayers earning more than $200,000 a year, $250,000 for couples. Estimates of the total amount in tax cuts for both wealthy individuals as well as wealthy businesses range from $600 to $880 billion. Representative Davis needs to speak to this. He needs to explain to his constituents what health policy reason there is for including such a massive tax cut in a health reform bill. He needs to explain why it is that he is okay with voting for massive cuts to the Medicaid programs in order to help pay for these enormous tax cuts for the extremely wealthy. The tax cut in this Republican bill amounts to a transfer of wealth. The American Health Care Act would reduce the average incomes of Americans in the lowest 60% of income earners, many people in this room, mostly because of the reduction of tax subsidies for the insurance premiums, which can be gotten through the marketplace right now, according to the Tax Policy Center. But it would give the incomes of those in the top 20% and especially the top 1% a significant boost. In general, the Tax Policy Center found, quote, repealing the health reform law would, on average, cut taxes for the rich and raise them for low-income households, unquote. Taken all together, the changes resulting from the American Health Care Act make it appear as if House Republicans are preparing to gut health coverage for millions of Americans in order to fund a tax cut for the rich. Lastly, I wanted to make a couple of brief comments about the Congressional Budget Office, because that is something that Representative Davis, when challenged with Congressional Budget Office numbers, is in the habit of discounting. As Chris said earlier, the CBO has not yet scored the amended American Health Care Act bill that passed the House on May 4th. However, the estimated number of 24 million who will lose health insurance under the American Health Care Act comes from an earlier scoring of that bill by the CBO. Representative Davis routinely discounts the credibility of the CBO by citing how, quote, inaccurate the CBO was about the number of people expected to be enrolled as a result of the Affordable Care Act. What Representative Davis needs to know is that the number of uninsured in the U.S. remained greater than anticipated by the CBO score of the Affordable Care Act, primarily because the CBO did not anticipate the Supreme Court case that allowed states to decide if they wanted to expand the Medicaid program. Many states did not expand Medicaid, and this accounts for the largest proportion of those who remain uninsured in the United States. What consumers need to know is that the Affordable Care Act is still the law of the land. I want to urge any consumers in our community who are uninsured to contact us so that we can help them get covered while they still have that opportunity. The American Health Care Act has passed the House of Representatives with support from Representative Davis and all the Republican members of the Illinois delegation, but the Senate has yet to do its work. This will be an ongoing process, and people need to stay engaged and involved. To that end, we want to urge Representative Davis to hold a public meeting to talk about the Affordable Care Act, about Medicaid, and about the American Health Care Act that he voted for. People need real and factual information, not talking points from a Republican playbook or false reassurances. I would also like to let Representative Davis know that I would welcome the opportunity to have a public dialogue or debate with him about the Affordable Care Act and Medicaid and the effect of the bill he voted for. I want to explain why I feel qualified to make this offer. I have over 20 years experience working here at Champaign County Healthcare Consumers, working directly with consumers and evaluating health policy at the state and federal level, and witnessing the impact of that policy on the lives of consumers here in our community. I was here helping consumers in the pre-Affordable Care Act days, bearing witness to the failures of health insurance and the suffering of our clients. These were the days when we left health insurance regulations up to the states, the days to which Rodney Davis wants to return us with his support of the American Health Care Act. These were the days when we said that everybody should be able to get their health insurance from their employer. Well, we had a couple people speak here today who were longtime employees of the U of I and couldn't get health insurance from their employer. Our organization will fight every step of the way to keep us going back to those days. I hope Representative Davis will take us up on our offer and give his constituents an opportunity to hear a robust health policy discussion or debate. And that concludes our formal remarks. I just want to make sure that people know that in your packets that we handed out, Healthcare Consumers has a summary sort of what we talked about here during the press conference, but we also have factual information from credible sources that you can take a look at and see where we draw some of our numbers. So I want to thank all the speakers today. Thank you, Julie. And thank you, healthcare consumer staff members. And thanks to our consumers, Jim and Deniece and Kevin. And we'll be ready to take questions. And what I wanted to find out from the media is, would you rather speak to people individually or ask questions of a panel? Do you have a preference?
I can do it either way.
Individually is fine.
Okay. So then, okay, we'll let y'all speak to whoever you want, and we can release folks. Thank you very much.
You got it.